Hello, and welcome to this Drexel University Libraries tutorial on forming a PICO question. We're going to explore common types of questions in medicine and then discuss how to form those questions into a format that will enable you to perform more effective searches. To effectively form a question, first let's examine the common types of questions in medicine. They are prognosis, diagnosis, etiology, and treatment or therapy questions. PICO format is a useful method that will help you focus your questions and conduct your search. This format consists of four parts. First, the P will be your patient, population, or problem. Essentially, what group are we looking at for our question, and what is the major issue they are presenting with? Second is the I for intervention. Specifically, what kind of intervention is being considered. Next, we decide on C, the comparison aspect. Is there another intervention to be considered? This could be a different medication, another form of treatment, or no treatment at all. Finally, the O asks, what outcome are we looking for? What is the desired effect you would like to see? Are there effects that are not wanted? Do you wish to avoid specific side effects? This acronym is most commonly deployed as PICO, although occasionally you will see a fifth component, time, represented with the letter T. However, avoid including time phrases in your search as articles are not indexed by time. Instead, a time frame is something to keep in mind as you review search results. Caution must be exercised when forming clinical questions. A vague, nonspecific question such as, do flu vaccines affect patients with asthma? Will not bring you adequate results you can apply in evidence-based practice. It is for this reason we use the PICO format of framing questions. Specificity is key. You don't necessarily use PICO format in a search box, but it is a helpful tool for looking critically at your question by identifying specific terms you'll want to use. Let's look at an example of a clinical question in PICO format. Is the flu vaccine safe for a 10-year-old female with pre-existing asthma? To format the question, let's break down the components of our original query. In this example, our population is a 10-year-old female with asthma. The intervention we are considering is the influenza vaccine. We want to compare it to not administering the influenza vaccine. The outcome we desire is to reduce the risk of flu while not exacerbating the patient's asthma. If we include the time factor, let's say we want to avoid asthma exacerbation in 24 to 48 hours after the injection and reduce the risk of flu during the flu season. This is how we would apply PICO format to create our clinical question. Thank you.